Now, I know that some of the men and women come to you with estrogen dominance, and this is becoming a big problem, but you also developed...
Becoming?
It's been, right?
I don't know. I've been in this field a very long time, and I don't ever remember. I don't remember this not being part of the equation, but yeah.
Yeah. So, and you were mentioning some really elegant ways to determine some of the problems related to estrogen metabolism, some of the corrections. With those corrections, what are you seeing as the benefits for patients? What do they notice? There was a series of things that people that come to your practice, in other words, what are they seeking you out for?
Well, patients come to see me mostly because they have fatigue, which is unresolved with other clinicians that treat them. They have GI issues, which are unresolved with all the therapy that they have. They have cardiovascular issues that they want to have a more aggressive integrative approach on. And I see many patients who come in who are menopause and who have low testosterone who seek me out because in Chicago I'm the expert in the hormone replacement therapy for women in menopause and for men in andropause.
Yeah.
The question or the statement they had about the estrogen is, I always want to make sure that clients know, as well as other practitioners, that none of the hormones are bad. They're all good, but they have to be at the right level, and they have to be in the right balance with each other and maintained in that balance long term. And so initially when patients come in, frequently guys come in with high estrogen levels relative to the amount of testosterone that they have. And that's the important distinction between the estrogen needs. You need to know, be able to evaluate these men who are obese, who have symptoms of estrogen which may be out of balance with their testosterone, including prostate issues, prostatitis, enlarged prostate, urinary difficulty, nipple tenderness, nipple swelling. They're changing their emotional state. They become more less decisive. They become, they become more emotionally involved with things that they hadn't before. So all these are symptoms of not only low testosterone irritability, but it's also relative to the amount of estrogen they have as well. So it's bringing the estrogen into a balance with the testosterone, and you do that through, number one, nutrition. Now, as you probably know, a lot of times people sought me out because they came in because I just want the hormones. No one coming into our office just gets the hormones. Period.
So they need an integrative approach, really, a lifestyle, nutrition, fitness, and then tying that into where the hormones are appropriate.
Correct. That is absolutely correct.
Now, you shed some light on a CBS network interview recently, a few weeks ago, and that was a very profound thing that kind of rocked the industry because they were saying, well, testosterone's bad, and they were going into all these things. So share with us a little bit about what you were able to...
Most of the doctors in integrative medicine understand the study that was done by Vias that showed that the testosterone that was given to the VA group showed an increased rate of heart attacks by a significant amount over the ones that had placebo. But there's so much that we don't know about that study. The methodology that they were giving the testosterone, it's assumed was the androgel, and that concentration we don't know as well, but it's assumed that it was 100 milligrams of testosterone, which is an astounding amount to give to any guy. Any integrative medicine physician knows that most guys need between 10 and 15 milligrams a day of testosterone. So we're looking at superphysiologic doses.
They're supposed to use it daily, 100 milligrams?
Yeah. But that's all. We don't know the exactness of what they were given, how they were given it,
and there was
how often they were given
with
it.
Compliance too.
And there was.
They say oftentimes people took it once and then.
Well, we don't know that. We don't know how compliant they were or not. The other thing is we don't know whether they were measuring the estrogen levels, how they were measuring those, were they measuring the hemoglobin. So these guys had more heart attacks. There's so much that we don't know about this study. It's a very poor study. There are literally hundreds, if not thousands, of testosterone studies that show the benefits of testosterone in the right patient, for the right reason, at the right dose, in the right method. Period.
And I think you would agree, a patient who does need hormone replacement, when they're on a well-designed dietary program and exercise, those are going to make those hormones work much more effectively.
Much better, and usually require you to give much less of the hormones themselves. Correct.
And I think
it's all integrated. It's all synergistic with each other.